There has been a problem in seeing anterior commissure lesions in doing surgery. So what are the options? Definitely they are difficult situation patients, and in OPD we cannot assess that this patient may be a lean thin patient, will not create a problem in seeing anterior commissure, and sometimes very thick patients, very heavyweight patients, and they are very easy to reach anterior commissure. So before general anesthesia, and this is not easy to define that this patient will have a problem in seeing anterior commissure or operating anterior commissure. So what are the options? Now we have two types of laryngoscope. Everyone has this other type. So this is a straight one, and when there is a lesion, we can see in larynx, which is directly straight lesion is visible, then only lasers can be used. So this is how we use in laser. So laser is attached, microscope attached. If the lesion is straight visible, this is the option only when we can use CO2 laser, because laser cannot be tilted. So this is not possible when the things are not visible straight. So that option, which is best in larynx, is not used. Now what is the next option if the lesion is not visible or anteriorly placed? So we have this endoscope laryngoscope. In this there is a tilt anteriorly, and even the 0 degree, which is wide angle 0 degree, is able to see all around very well. So there is no need for 30 degree or 45 degree endoscope. So when we attach 0 degree endoscope in this laryngoscope and lock this, so vision is improved instantaneously. But the limitation is we will have to use either cold instruments or radio frequency. Now this is the chest support which we have made ourselves. So this is a steel assembly, and this is a platform. The thing which is ready-made available in surgical shops, that does not have this platform, so there is sometimes problem. So what are the instruments or adjustments which can be helpful in seeing anterior commissure? So seeing is that, and working. Now we have 3 suction available. We have to turn our instruments because we can see the lesion, but touching, doing suction or operating becomes difficult. So suction, we have 3 tilts: mild tilt, moderate, and too much tilt. So whatever is situation, we can use the suction. Then there are tilted instruments like the scissor. We can see there is a 15 degree tilt anteriorly. Then there are malleable instruments available by stores. So this is a scissor which we can turn. This is a forceps which we can turn whatever the need is. So these are the instruments which can be helpful in operating anterior commissure. Then we have a tilted radio frequency tip for taking biopsy, operating instruments. That is important. So in lesions like polyp or hemangioma or things like that, when we do by cold instruments, that is not enough, because if the base is there, we'll have a recurrence. So we'll have to cauterize this either by laser or by radio frequency, so that the voice quality is not disturbed and lesion is not recurrent. Even after doing all these things, there are few patients where we have to abandon the patient because lesion is either not visible or we are not able to remove that. Thank you. In endoscopic laryngoscope, the advantage is when the 0 degree endoscope is applied, we can see this is 0 degree angulation, and we can see 30 up to 30 or 40 degree angulation. Things can be visualized, and by tilted instruments we can operate those patients. But by changing endoscope like 30 degree, 45 degree or 70 degree, the vision will not improve, because the limitation is this flange of the laryngoscope. So just by changing the angle of the endoscope will not improve the vision. We have to work with this 0 endoscope, and almost all lesions are visible with this 0 degree endoscope. But the problem with this endoscope is this has got an internal channel for the endoscope, and sometimes instrumentation becomes difficult. Suction or instrument goes either on one side of the endoscope channel or the other side, and when the lesion is in the central place, sometimes this is difficult to operate. Then we have two wonderful instruments. One is microdebrider, the tip is angled, we can reach up to the commissure, and cobblator. So this have suction, ablation as well as irrigation.